Now move towards the treatment plan, which is very important. So let's start it. Bismillahirrahmanirrahim. What are the objectives? First of all, facilitate the maintenance to maintain, and then to prevent further attachment loss, and also obliterate that furcation defects, that is as a periodontal maintenance problem. Okay, so basically now we'll study therapeutic classes of furcation defects. If there is class 1 defect, for example, which is an early defect, and there is no significant bone loss, and there is just suprabony pockets, and it has affected the soft tissues, so what we can do is that actually we will and the furcation and basically it has the pocket has not been entered into the furcation, so we will do oral hygiene instruction, scaling, root planning are very effective, and for overhanging restorations or for grooves or for the cement to enamel projections, we will do odontoplasty or recontouring or replacement. For the resolution of inflammation and for the repair of PDL and bone are usually sufficient to restore periodontal health. Means when you resolve the inflammation, so eventually your PDL and bone will be repaired, so it will restore your periodontal health. Okay, in class 2, once a horizontal component of furcation has developed, means there is class 2, means the furcation has been involved horizontally, so then the therapy becomes complicated. Shallow but horizontal involvement without any vertical bone loss can have response favorably to localized flap procedures. You can do odontoplasty, osteoplasty, and osteoectomy. 3 procedures you can do it. If there is just only horizontal bone loss, no any other vertical, so you can do odontoplasty, osteoplasty, and osteoectomy. Isolated deep class 2 furcation can also respond the procedures to flap that is done with osteoplasty actually and odontoplasty. This treatment actually reduces the dome of furcation also, and also changes the gingival contours in order to facilitate or control the patient's plaque control or remove the plaque. In classes 2 to 4, advanced defects, when there is horizontal component to one or more furcations of multi-rooted teeth and development of also vertical component, so non-surgical treatment is usually ineffective. Means then the scaling, the root planning, or hygiene become ineffective. Now you have to treat it some surgery. So then periodontal surgery, endodontic surgery, restoration of the tooth may be required to retain the tooth. So in first, it was an early defect, so we prescribe the patient that either will give the oral instruction, root planning, scaling, and basically we'll give odontoplasty, recontouring of the replacement, and restoration for the overhanging margins. And when we remove the inflammation, so bone, the PDL and bone will repair. In class 2, what we have said, there is horizontal component involved but there is no vertical, so we will do odontoplasty, osteoplasty, osteoectomy. In class 2 to 4, when advanced defects, so the when there is horizontal component as well as vertical component, so there is no use of non-surgical treatment. They become inactive because the ability to instrument the tooth surfaces are adequately compromised. So in this, you give the periodontal surgery, endodontic therapy, and also restoration of the tooth. Okay.